Rejection-sensitive dysphoria, or RSD, is a condition that causes intense emotional responses to rejection. People with RSD experience rejection very strongly. Even small rejections feel very painful. Now, RSD is not an official diagnosis, but it is often linked to ADHD. Many people with ADHD experience RSD, and researchers are still studying RSD to understand it better. RSD can make life difficult. People with RSD may avoid situations where rejection is possible, which can impact relationships, work, and social life. It's important to remember that RSD is manageable. Understanding RSD is the first step to finding helpful coping strategies. ADHD and RSD are often linked. Many people with ADHD also experience RSD. The exact connection is still being researched, but one theory involves brain chemicals. ADHD is linked to differences in dopamine, a chemical that affects our reward system, including how we experience rejection. People with ADHD may be more sensitive to changes in dopamine, which could explain why rejection feels so intense for those with RSD. Another theory focuses on emotional regulation. ADHD can make it harder to regulate emotions, and this difficulty can make rejection feel overwhelming. More research is needed to fully understand the link between ADHD and RSD. However, recognizing the connection is vital for providing proper support. RSD causes intense emotional reactions to rejection due to how the brain processes emotions. When we experience rejection, the amygdala is activated. The amygdala is the part of our brain that processes emotions like fear and sadness. In people with RSD, the amygdala may be more reactive, meaning it responds more strongly to perceived threats like rejection. This leads to more intense feelings of sadness, anxiety, or anger. Furthermore, the prefrontal cortex, responsible for regulating emotions, may be less active in people with RSD. This makes it harder to control and manage those intense feelings. The combination of a more reactive amygdala and a less active prefrontal cortex contributes to the overwhelming emotional experience of rejection in people with RSD. Section 4. Recognizing the signs of RSD. Recognizing the signs of RSD is crucial for seeking help and support. Individuals with RSD often exhibit specific behaviors and thought patterns. One prominent sign is an extreme fear of rejection or criticism. This fear can be debilitating, leading individuals to avoid social situations or opportunities for growth. They might constantly worry about displeasing others or making mistakes. Another sign is oversensitivity to perceived rejection. Individuals with RSD may misinterpret neutral cues as rejection, leading to emotional distress. A slight change in tone or a casual remark might trigger feelings of inadequacy or worthlessness. Physical symptoms, such as a racing heart, sweating, or difficulty breathing, can also manifest during episodes of perceived rejection. These physical sensations further intensify the emotional experience. Section 5. Differentiating RSD from other conditions. While RSD shares similarities with other emotional challenges, distinguishing it is essential for targeted intervention. Social anxiety disorder, for instance, involves a fear of social situations, but the primary concern is the fear of scrutiny or judgment, not necessarily rejection. Individuals with social anxiety may avoid social gatherings altogether, whereas those with RSD might participate but be highly sensitive to criticism during interactions. Generalized anxiety disorder, on the other hand, involves excessive worry about various aspects of life. While rejection sensitivity can be a component, it's not the sole focus of anxiety. Individuals with generalized anxiety may worry about finances, health, or work, in addition to social rejection. Understanding these nuances helps differentiate RSD from other conditions, allowing for appropriate treatment and support. Section 6. Coping strategies for managing RSD. Managing RSD is an ongoing journey that involves developing coping mechanisms and building resilience. One effective strategy is cognitive reframing. This technique involves challenging negative thought patterns associated with rejection. By questioning the validity of these thoughts and replacing them with more balanced perspectives, individuals can reduce the emotional impact of perceived rejection. Another helpful strategy is practicing self-compassion. Individuals with RSD often engage in self-criticism and negative self-talk. By treating themselves with kindness and understanding, they can cultivate a more supportive inner dialogue. Additionally, engaging in activities that boost self-esteem and confidence can be beneficial. Pursuing hobbies, developing skills, or volunteering can foster a sense of accomplishment and worthiness, mitigating the impact of rejection.